everybody. My name is Jennifer Quinn. I just want to thank you so much for being here. Actually, it means a lot to have the support. But my research topic is on the impact of the American Association of Retired Persons Age-Friendly Network on elderly housing cost burden. And I'm looking at this from the lens at the county level. So I'll go a little bit more into what the AARP is in a minute. But this is a general agenda, background, motivation, literature review, what I found, and inferences that I'm making. So, background. The AARP stands for American Association of Retired Persons. It's the largest nonprofit, nonpartisan organization for aging Americans. And they have over 38 million members. So basically all that members do, it's $15 per year. And then you basically get a subscription into like discounts, and it's mostly for people over the age of 50, but actually if you're 18, you're actually eligible to join the American Association of Retired Persons. So they have a lot of policy advocacy, and one of the things is they're actually a major lobbying group. So again, they have resources for the retired people, and then member benefits even if you're not over 50. They have an age-friendly network, which was just started in 2012 as a branch from the World Health Organization. And this age-friendly network is basically like hand-holding communities through projects to help the elderly citizens within their community. So for example, one of them, basically a framework is they have a 5-year plan. So the community signs with American Association of Retired Persons, and they write out their plan, and then in the first 2 year, they basically say, what can we do to help out aging population within our community? And then in the next few years, they do implementation, and hopefully at the end of the 5 years, they can collect results and then move forward. So that is the main goal. It doesn't have to be a 5-year plan. It depends on the specific county, and every single community has their own plan. For example, one community could be focused on making a community center. One community could be making a park. So it's different for every single county, and I also have to specify that it's different. The actual implementation is at a different year for every county too, because it only started in 2012. Some people might have joined in 2017, 2020. So that is the background. My motivation for studying this, I think this is really important. There's the 65 plus population within the United States. It's growing so rapidly. There was a projection from the Census Bureau that in 2012 we were at 13.7%, and they projected 21% in 2050. And currently in 2026, we're already at 19.2%, so we're actually above target. Basically, there's such a growing population of elderly, and I want to see what are the policies being made so to help out this growing population. What are we doing to prepare? Because if there's a great set of older dependent people, then we're going to have to our social systems are going to be strained, our healthcare systems are going to be strained. So I really want to see what policies are being put in place, and actually is there any impact on them. So the AARP Age-Friendly Network is the policy that I'm looking at. And they have over 1,000 communities. I'm just looking at the county level, and there's been 298 counties that have joined this network, which is around 9%. There's over 3,200 counties within the United States, so around 9% have actually joined this network. Existing research, there actually isn't much about this AARP Age-Friendly Network because it's only been here since 2012. So in my study, I really want to focus on the housing domain, and I want to see elderly housing cost burden. So elderly housing cost burden is just a percentage of if you pay more than 30% of your gross income on housing-related expenses, for example, rent. And my research question is, does joining the network reduce cost burden households over the age of 65? So basically, all I'm asking is, does joining the network have an impact on percentage of elderly people that pay more than 30% of their gross income on housing-related expenses? So, literature review. Again, I said population aging is rapid and global. This is not only something that happens in the United States, but it's happening all over the world. There's slower growth, higher dependency, and like a huge demand in healthcare that we're gonna have to figure out. So again, with housing affordability is really critical, because AARP, they really strive and say that older people really want to live in a place that they've been living their whole life. There's this thing called aging in place, and one of the statistics from the AARP was that 90% of older citizens say they would like to age in place. Now that statistic is higher and lower depending on sources. The AARP says it's 90%. As I said, there isn't much research on the AARP age-friendly network, but the one source that was basically looking at the impact of it was this Jung and Warner paper from 2025. It linked improvements, basically joined the AARP, and improvements in the AARP livability index. So that was like a broad research, but the thing with the livability index is that it was created by the AARP. So you're using the AARP's own metric to assess the AARP, which I looked through, and I'll definitely talk more to the researchers at the AARP who were actually so nice and gave a Zoom session with me to talk over their process. But I'll definitely need to reach out back again. But anyways, they use the AARP's livability index to assess their joining the AARP program, and they did it at like a higher level. So the one that I'm doing is 65 plus cost burden households, which is much more specific. So the AARP has these 8 domains, and the Jung and Warner paper looked at all of these indices from the livability index at like a high level. But if you can see over here, like in the smaller ones, I really wanted to, like, my final goal is to actually look at all of the 8 domains and all of like the indexes within each domain and assess them one by one, hopefully. But right now, I'm starting on housing, 65 plus cost burden households. So my data was mostly from the American Community Survey. I was really grateful that there's this thing called FIPS, which Professor Baker told me about. It's basically a code for every single county, and it was really much easier to merge counties by the FIPS code. And so you can see most of my data is from American Community Survey, 5-year surveys, and the other one was from the USDA codes on the urban rural classifications, and the actual joined or not variable, I like just manually took all the counties that joined from the AARP's own website. So my treatment variables, I want to specify a little bit. My main variable is joined. It's time varying, it's binary. It's going to be 0 if they haven't joined, 0 before joining, and 1 after or during the year that the county has joined. And ever joined is static. It's either 1 or 0 depending on if they ever joined or not. Year since join is just how many years have since they have joined. It's blank if they've never joined at all. So I don't know what happened. Okay, but anyways, my dependent variable is percent of households age 65% plus that are cost burden. And sorry, that's supposed to be a beta in there. But my independent variable is the variable join, and I have my control variables on the X index over here, and county effects, year fixed effects, and the error term. So it's really simple. My results, after running the regression on the join variable and percent 65 plus cost burden, the first one, I just did a simple regression. I didn't add any controls, anything, and then the outcome was actually positive, 0.8. So joining actually increases percent 65 plus cost burden. That's weird. But afterwards, I added the control variables, and I also added fixed effects. And model 2 is control variables, model 3 fixed effects plus their standard errors, in order to basically take into account autocorrelation, heterogeneity, and I found no significant effect in those 2 models. And also the beta was extremely small. So basically I'm seeing like there's not really, I can't find, I don't know if there is, but I can't really find any relationship between joining and 65% plus percent 65 plus cost burden households. So I needed to double check that, robustness checks. The first robustness check that I did was time relative. So thank you to Professor Greenblatt for introducing the event study to me. Mine isn't exactly an event study, but my variable years since join kind of acts like that. So I have in order to avoid dummy variable trap, I cut out negative 1 year pre-join. And I looked at it, and the coefficients are all really, really small, and they're not significant either. I think it's better visualized, but you can see over here, this is the blue line over here, and it shows, you see 0.0, negative 0.01, and they're all not significant. And the results align with the main regression that I just went over. So, and what's going on? So there's no, I can't find any relationship in my robustness check. So my third robustness check that I did was restricting population, and thank you to Professor Vandergrift for telling me about this, but there are big differences between counties that joined and didn't join the program, and one of them was total population. So the total population of people who joined the county was far greater than counties that didn't join. And there were also some other differences, like there were counties that joined had high percentage of bachelor's degree, people with bachelor's degrees, and also were wealthier in general. So one thing I did was restrict the population to greater than 100,000. There were still enough, over 100 counties that joined the AARP, and over 400 counties that didn't join the AARP, so I could still make inferences. But I also did the no controls, with controls, and fixed effects for Model 3, and I still found basically like no relationship between joining and percent 65 plus elderly cost burden. So before I get into the result, my interpretation though, I'm going to go over percentage of population age 65 plus and older by the time AARP. So one thing I was thinking about was, wait, why does the AARP, care so much about aging in place? And like, is there maybe a tax incentive for older people to stay in your county? Is there, I don't know what other sources there are. Are you trying to pull people in by making housing outcomes better? And are they succeeding? So I compared counties that never joined, counties that ever joined, and basically you can see a 2 percentage point difference in the gap between the blue and orange lines, but that gap stays consistent over the years, and you can't really see any difference between joiners and non-joiners, and if there's any increase in people coming in or moving out. So this just is another thing where I was like, does joining really make a difference in terms of this housing outcome that I looked at? So I did my 3 models, the first model with my join variable, my second model with the year since join graph, my third model restricted with population over 100,000 people. And basically all 3 of them showed that I can't prove any relationship. I failed to find any relationship between joining and percent 65 plus cost, alleviation of cost burden. And I want to go into a little bit more about like next steps later, but I do want to say the limitation of my study right now is that I'm looking at only at counties that have joined, not counties that have actually implemented their plan. So there's a huge difference between signing something and saying, hi, I'm going to do this, and another thing versus actually doing it. And there's actually 68% of AARP age-friendly network like joiners don't follow through with their plan, which means that 30% of them don't. So that's another limitation of my study. I didn't look at the actual implementation, I just looked at if they joined or not. And another thing I just realized was two-way fixed effects has been disputed, and there's a new model which I will get in, I will look more into. There's a 2021 paper that looks at a different way than two-way fixed effects. But other thing, I don't want to jump into like directly into conclusions about, oh, the AARP, like they don't do anything. They like I love that, but I have to I've only looked at this one index of percentage 65 plus elderly cost burden, and I haven't looked at all the other 8 domains that were there. And also there's other housing outcomes that the AARP is interested in. For example, they were interested in zero-step entrances for elderly to easily access their homes. So this is like too small to make a big jump yet, and also this isn't causal. I didn't actually run an experiment with actual control and group, but I want to discuss implications of this. Even though I said all my limitations, there's my models show that there's no real relationship between joining and this housing outcome I was interested in, and so policy alone might not be enough. It seems like it's common sense, but like actually signing the paper is not the same as actually implementing the policy. The 68% that actually implement it and the 32% that don't, there needs to be a clear comparison of why some counties follow through and why some don't, and how we increase those 32% and join the other group and follow through with their plan. So that is something else I really want to look into. I talked to the AARP Age-Friendly Network people on Zoom last year, and basically they just didn't have all the data ready yet, but I'm going to ask again and see if I can get the whole data and if I can parse through it myself. And basically, also I didn't mention this, but in my controls, like poverty, income, housing markets, they had more significant impact on housing cost burden. And again, about the implementation, and I'm only looking at this one variable, and the next steps are that I really, really want to look at all the 8 domains and more of the variables that I put up on the slide. I really appreciate Jeannie number 3 for saying, telling me about the Dunning-Kruger effect. I think that, like, aside from like me not finding any relationship, but the fact is I was at the top of the fact. Basically, it's like, oh, if you don't know anything, you're at the top, you think you're like competent, and then you go down and you're like, oh, maybe I don't know anything, and then you like plateau off. But yeah, I was at the top until a month ago. But I would appreciate that. Yeah, this I think my findings aren't amazing, they aren't super cool, but the actual process of learning and talking to all the amazing professors who actually showed up for me was really, really cool. And I have a lot more respect for data analysis and methods of research. So my next steps, primary data collection. One thing I really wanted to do was do phone surveys with people who, counties that joined the network and people who worked with the AARP. I spent a couple hours last week trying to call them, but I went through basically the phone chain, and there's not really a single designated person, which I should have like thought of. And basically it's probably, even though it's listed on the website about one person, this one like agency who runs AARP within the county, it really is more sporadic, and even it's not as simple as what I thought it would be. And other things, talking to researchers, I actually reached out to John and Warner last week, and even though they are traveling this week, I will reach back out to them and talk about how they actually did their research and how they use the livability index. And number 2, look at indicators for more of the domains. This one is just so small, and there's 8 domains, so there's many other ways to measure those 8 domains. And number 3, something that I like didn't realize, but until now, is that nonprofit organizational dysfunction is a really big thing. They're full of these really like wide-eyed people who want to do the best, but they don't actually know how to do it. And I didn't realize that was, I volunteer with a mental health nonprofit and have some of the same issues, but I didn't realize it was such a big issue. But at the end of the day, I really want to see how can like this research actually, at the end of the day, I'm always thinking like, what's the point of doing this research? And I think the next best step would be to compare the joiners versus non-joiners for the AARP not joiners, the implementers of the AARP Age-Friendly Network, and compare what's going on between them and see how we can shift the 32% that don't actually follow through into the other basket of people that do follow through. So I want to thank you for listening to me rant, Professor Chernoff for always supporting me. The whole class does agree. And Professor Greenblatt, Professor Vandergrift, Professor Baker, Professor Withrow, who's sick today. Thank you for telling me about FIPS, about icons, about event studies, restricted samples. There's a lot of things that I didn't realize about like this whole process. Every single one of you said something slightly different about the research process. And it was really interesting to see how different researchers connected research in different ways. And AARP, I'll reach back out to them, and I have to like really thank them for still holding the Zoom with me. And I have to thank, this whole slideshow was actually created by Claude, not the actual information, but the actual template. Really cool. So I want to thank you all for listening to my long rant, and any questions?
You discussed how the age-friendly network forms a plan that the community can implement. May I ask, would you know what the typical plan looks like for these 5 years?
Yeah, so for example, if they want to build a community center, elderly, right? In the first 2 years, at least that's what they wrote on their website. The first 2 years, they would collect data, ask people what they want in the actual center, and then in the year 3 or 4, it'd probably take longer to actually build a community center. But in the middle years, they would actually build it, and then afterwards, they would collect data and see how it's going. But a lot of this data is really recent because they've only started it in 2012. So a lot of the counties that joined didn't join in 2012. They were joining in 2020 to present when it got started rolling. So we don't actually, another limitation is that it's a little bit early to tell what the real impact is. Sorry.
Thank you.
Thanks, Nathan. Yeah.
Hi. My question is about, you references the inequalities between participants and joiners. I feel like also, do you think that there's more like a way in we can bring the message to not just middle class but also low income? Because I feel like low income will benefit better from this type of efforts for AARP, especially for young individuals. But if they don't know because it's so new, do you think that aside from policy, it's more like informational, like bring this message to them?
My mom brought up the exact same point. The joiners, yeah, there's a big difference between the joiners. They're more educated, they have more resources, they're richer. So one of the things like I'm thinking about were subsidies for counties that, low-income counties to join this network and be handheld through this process, which again, the AARP Age-Friendly Network doesn't actually do the work. They basically just help you through the process. The actual counties are just doing the work. But yeah, I was thinking about subsidies for those low-income counties, so I was wondering about, again, funding, and that is something I will bring up in a Zoom session with AARP people and see if they probably already thought of it. But yeah, thank you.
So sorry I arrived late, but you were mentioning resources you were looking into. How do you think that would, if you know, impact the current data you have, since you noticed that in some cases more correlation of causal?
Yeah, okay. Correlation versus causation was like a big thing. I was like, oh my gosh. I was talking to professors about it, and then one professor was like, you can't really do that, but another professor was like, it really depends on who your audience is and if you can just convince them that it's causal. But is that not true?
Who said so?
Oh, I can't reveal them right now. But yes, based on your question, right now everything is just like correlation. It's basically what I can infer. I can't make like, oh, AARP, there's no impact on housing. I just didn't have collect enough data. I also think that if I were to look at housing indexes, I would also have to include more than just percent elderly cost burden households. I would also have to look at other indicators like the zero-step entrance, and not the AARP does do that. They didn't publish the data that was like step by step, which they used to calculate it, but they didn't publish it. So I need to reach back out to them about it.
This is not the question, but a piece of advice. I have some experience with volunteers, community organizations, and I share your frustration. People do volunteer for various reasons, and you don't always get the outcomes that you would expect from a professional organization. That said, looking for data, my way of doing would be go for the very top, contact the president's office, explain the purpose, and as a student who is doing research, seek help. And they may guide you, bring you down, and with their recommendation and advice, more doors will open instead of starting from below and fighting, trying to open the door.
Yeah, that's actually what I did.
Oh, you did?
Yeah, but no, I definitely need to reach back out to them. And there were 2 researchers who were in the Zoom with me. Maybe I'll, like, I don't know if, like, I reach out to their boss, but you're saying,
If you offer to share your results and what you are doing may benefit them, so work as part of their team, another volunteer, but trying to get information from small community-based volunteer organizations may be difficult unless you happen to hit the right person, and that's not very frequent.
and with the data, like all my data I got from American Community Survey that I was running the regressions on, and wait, at the end someone was telling me about how, you know, all of this data I didn't collect it myself, and then they were really emphasizing on primary data and calling like every single like county that joined. And I don't know if any of the professors here have had any experience doing call type.
Survey
Yeah.
based on phone calls.
Yeah.
Without land-based phones, it became almost, well, it's difficult. You know, we used to do it with land-based phones, it was easier. With cells, people are caught at different situations and unknowing. Paper survey is probably another way, which is expensive.
Yeah, I would say the more standard approach with an organization like this would be to, it's county governments, right?
Mm-hmm.
Would be to come up with a survey and send all of them a paper survey. Or an email survey maybe if they have.
Maybe email survey and going from the top, sharing survey with them, explaining the purpose, telling them that the results will be shared and may help them in understanding the community, and that may give you access to electronic window.
Because I was just worried that like they have like 1,000 emails per day, and plus they're not their only, like their job isn't only to look after the AARP. It's like a billion other things too. And
How is it different than a phone call?
I don't know, because I'm like actually talking to them, but I can't get hold of them anyways.
And
So.
then you catch them at the wrong time. Survey may give them an opportunity, especially they're retired. So hopefully they have more time to look at their emails than if they were in the midst of their career.
The people, I think the people actually running the AARP network within the county aren't retired, but
The
yeah.
very top is a group of very well prepared, trained, educated retirees.
Okay, I shall do that. Yes.
I noticed you were looking at the AARP, but did you find that do you look at potentially any other organizations that might also impact the effects of housing cost burdens besides like the more macro environmental factors that you were looking at with housing prices?
Yes, so that was my initial plan. My initial plan was to look at and collate all the policies regarding age 65 plus people. And then I thought that, oh wow, again, I was at the top of the curve, the curve that you were mentioning. But no, I thought that'd be so easy, but there's actually no source that like collects all the policies together. And the reason I chose AARP was because I could do it, you know, there's enough data and I could actually feasibly do it. But yes, that would be so much cooler if I looked at all the policies. But Need a little more time for that one. Yeah.
Thank you. So if we could like think about the AARP more civically for a minute, I can imagine how aging in place is something that increases the political power of the AARP. If you have all of the old people living in Florida and Arizona, they don't matter as much on the national level. And if you're spread out across more states, there are more local governments and state governments that you can extract rents from. And so maybe that's the policy goal of the AARP, is not to make the members better off, but to encourage aging in place to increase their own political power. So that seems kind of consistent with the misrepresenting the number of people who want to age in place. So maybe you should see if that's what gets impacted by this policy. It doesn't improve affordability or make the members any better off, but it encourages aging in place and increases the political power of the AARP, and so it's successful in achieving that end.
Yes. Okay. Political power. Wait, which is also your research right now about Milton. Yeah. Really cool.
So I don't know, just a different angle to think about it from, because I could kind of see like why this shouldn't really impact affordability, right? Because these are all projects that local governments aren't choosing to invest in without pressure from the AARP. So probably they don't improve like property values locally. And so what's happening is that there are more services being provided, which is requiring increases in property taxes, and increases in property taxes are driving down property values, and so rents are staying the same, affordability is staying the same, and so all you're winding up with is a bunch of inefficient government investment.
I missed some of your presentation and tell me if you covered that, but what you are showing and what I understand is that the membership in ARP will be largely related to the big macro issues. So when we hit a point where Social Security has to be addressed, I would expect a bump in enrollment. People would like to have their voices heard. When the issues with Medicare brought up and potentially discussed and changed, you will have a factor that changes the membership.
Absolutely. They're the biggest lobbying group for elderly
Absolutely.
people.
In those issues, they vote as a bloc.
I wanna wait, okay, that makes sense. Like the whole idea about like political power makes sense. But then like I'm looking at it and you see like the percentage of 65+% between like counties that joined versus counties that didn't join. Like they follow the same trend though, just that the counties that joined actually have 2 percentage points lower percent of 65+ population. But that like the distance stays like around the same through the year. So I don't know if they are like keeping, like I don't know if the policy actually keeps people or attracts people in those groups, you know? I don't know if yeah. Can you repeat like your local government political power thing one more time?
Right, so like the more spread out the population of AARP members is, the more local governments AARP can like potentially extort. And so that sort of motivates the AARP to lobby for policies that would encourage aging in place. Because like I said, if all of the 65+ population like moves to Florida and Arizona, then the AARP can only really influence governments in Florida and governments in Arizona, which like narrows their target. If that makes sense, right? And so maybe what the AARP is doing isn't trying to improve affordability, they're just trying to push for policies that will encourage it.
Wouldn't it be distractive. If you are trying to convince your membership to cluster nationally, you become less relevant.
That's what I'm saying. I think they don't want people to cluster, right? Because that limits
That
their
becomes,
influence on the electoral
okay.
college, on the Senate, and so they want their
wide
population to
base.
stay
They
spread
want
out,
wide
so
base.
that they have more local governments
Mhm.
and more congressional and presidential
Yeah,
authority
I
than the
understand.
nations.
Have you looked at the states? Because there is also one factor that probably plays a role in terms of clusters of this cohort. Social security taxation. States that tax and do not tax. You consider that?
But I need to actually include it in the model. But yes, I will look more into that. And sorry.
Oh no, it's fine. I was just wondering about what, if you've like actually seen the counties. Do you know what percentage of counties that join the AARP not correlate necessarily, but are within like more states that are seen as like retirement, like have a higher retirement population than like those with lower retirements, like a lower retirement population?
I did not do that, and I will do that. I will look at the counties I've joined. Also, another thing is that AARP basically does state level, county level, and then city level. So it really depends on which level you're looking at.
Right.
But I need to aggregate the counties that have joined and see. Georgia is actually the state that has the most counties that have joined, which is interesting. They did like a coalition and they all just joined together. But yes, I will look at the county level. I'm sorry.
I have a weird question. Looking at your graph, isn't it like, are you better off with or without AARP, even though you're going through the same, like there's two populations go through the same factor, so they experience the same factor, so they're going parallel to each other. Is there a difference between being a member and not being a member?
Yeah, so my point was that there's no difference.
Well, you get discounts.
Sorry?
You do get
The
discounts.
discounts.
But are there
Discounts on
offsetting
travel.
for joining or
No.
not joining?
Yeah, so basically the whole, like I was trying to communicate that I don't see really an impact, at least on the housing indicator that I chose, between joiners and non-joiners. In this graph, I was trying to see if there's any population change, if joining counties just had like a sudden like increase of people pulling people in because of their joining, but there wasn't. So yeah, I have to look at more, but I failed to find.
I'll throw another possibility. Arizona typically gives you discounts if you show your AARP membership at restaurants. So, if you are living in Arizona and turn 65, you have an extra incentive because the savings go on through your restaurant meals. And that would increase the participation in counties that are using actively policies reducing costs of certain services.
I did not see Arizona that many times in the AARP counties that joined, but I need to look at it again.
10%. My father-in-law is an expert.
Okay. Well, wait. You guys mentioned the low income thing, and then reaching out to AARP, the head of them, sharing results, political power, more spread out, social security tax. Did Kirtan, you mention that one?
No, I did not.
Someone mentioned something. Okay, but social security tax, I'll look at that. And then Kirtan, you mentioned the retirement states and
Yeah.
the counties. Okay, and Arizona, AARP restaurant.
Arizona is what I'm familiar, but there might be other states that give discounts, wide discounts to seniors who have AARP membership card, which would induce them to join.
Another thing I'm gonna look into. Thank you all. Thank you all. I know you guys are tired, but thank you all so much for coming and staying. Hopefully this is not the last research I'm gonna do and gonna improve on. This is first test run to improve on for the future. Wait, but also if everyone could like come to the front and like take a picture, I would really appreciate that, because I can't believe you guys stayed for a whole, 45 minutes for me to talk. But